Hi, this is Allison Barnes, and I'm doing my final research presentation project for Global Communications Course 440. I chose to research the effects of globalization on healthcare around the world and here in the United States, more specifically. I chose to research this topic because I'm currently working as a clinical dental hygienist. And I have a lot of patients that have actually traveled outside of the United States for medical and dental procedures, and have quite a few patients who are considering or have questions in regards to seeking treatments in the future outside of the United States. So I thought it would be a good way for me to kind of get some evidence-backed advice to provide to my patients if ever asked about it. So I'm going to be discussing some of the effects of globalization on healthcare and medical tourism. Some of the pros and cons of globalization on healthcare, and what the future has in store for the globalization of healthcare, and then finally relate some of the concepts and topics that we learned in the global communications course to the research that I have done. So I started with a question in order to guide my research, and my research question is: how has globalization affected healthcare? What are the positive and negative effects and consequences from the globalization of healthcare? And what does the future have in store for the globalization of healthcare? So the globalization of healthcare, as defined by the World Health Organization, is simply the increasing globalization of the health sector. Traditionally, healthcare was something that was kind of confined to the geographic location of which you resided. But this is definitely something that's beginning to change. Some of the examples of the globalization of healthcare include the mobility of healthcare professionals and consumers across borders in order to seek healthcare or provide healthcare. Another example would be private companies that are starting to actually provide healthcare services as opposed to state and government agencies. And also new technologies that are providing different health services across borders through electronic health records and collaboration between American and foreign healthcare professionals. Globalization of healthcare in the United States has mainly resulted in exporting or medical tourism of healthcare. So people in the United States seeking healthcare outside of the United States. Importing of healthcare services, otherwise known as outsourcing. So that could include things like medical professionals from different countries coming to provide healthcare services here, or maybe outsourcing different diagnostic tests for readings of healthcare professionals outside of the United States. So a lot of collaboration between American and foreign healthcare professionals. Another effect that it's had here in the United States with the increasing use of medical tourism, which we'll go into a little bit more here in a minute, the U.S. is really starting to be forced, due to the competition of healthcare services around the world, is being forced to look at ways in which they can lower costs here in the United States to provide healthcare to those that are being forced to travel outside of the U.S. in order to have healthcare services. So those are some of the ways that it's affected us here in the United States. Medical tourism, the definition, is really just consumers crossing national borders in order to seek healthcare services. It used to be that kind of wealthy foreigners would travel to the United States or the West in order to receive healthcare services due to, I guess, our reputation for, stellar services in healthcare. And we're really seeing that start to change now. Middle, even lower class citizens here in the United States are actually traveling outside of the United States in order to receive healthcare services, mainly due to the affordability in other countries as opposed to here in the United States. As of 2010, roughly 40 billion Americans were uninsured. So that's obviously a reason for people to seek healthcare services outside of the United States. People can't afford it here, and so they're traveling to different parts of the world where they can afford it. An interesting fact that I found was the Apollo Hospital in New Delhi, India, for instance, offers a cardiac surgery for $4,000, that same surgery here in the United States actually costs $30,000. So even when you include the cost of travel and recovery time, staying in a hotel to recover from a procedure, still the cost is going to be much, much lower than what you would pay here in the United States. And for some people, they can't afford certain procedures here when they don't have health insurance, and they have to travel outside of the United States. Some of these procedures are, a matter of life and death. So that's definitely a reason why people would travel outside of the United States. So some of the benefits that I kind of came up with in regards to the globalization of healthcare. Number one benefit by far, like I had just mentioned, is cost. On average, people can save up to 80% on different procedures by traveling outside of the U.S. in order to have these procedures done. Another benefit that's being looked at is the possibility of savings for different state governments and federal governments by outsourcing some of their Medicare and Medicaid patients for certain procedures to be done outside of the United States where the cost is less. That is definitely going to be something that will, hopefully, potentially, in the future save our states and our nation a lot of money, and hopefully find ways to improve our healthcare system by kind of getting in the green as far as money is concerned. Another benefit is just a healthier nation. If there's people that are able to receive different procedures and medical treatments outside of the United States that otherwise wouldn't be able to afford here in the United States, inevitably we will have healthier people living in our country, and therefore a healthier nation that can strive. And then finally, globalization on healthcare is definitely a benefit of that, is going to be advances in medicine through collaboration of American and foreign healthcare professionals, different doctors, sharing different experiences, different treatments that have been effective or not effective. Maybe in the future, collaborating with different healthcare professionals in order to find cures for diseases that we haven't been able to find for decades. Some of the negative aspects of globalization on healthcare, I think one of those that came up quite frequently was there's fewer regulations in other countries for the same procedures to be done here in the United States, and that obviously opens the doors to malpractice and sometimes, deadly outcomes for people seeking certain treatments outside of the U.S. where people aren't as regulated in ways that they conduct procedures. The language barrier is definitely a negative when it comes to the globalization of healthcare. Communication is a really big part and key when it comes to seeking medical treatments and care. People need to be aware of the risks and the benefits of different procedures, post-operative instructions, all these types of things. It's very important to be able to clearly communicate between patient and medical professional. And that's definitely something that is a negative when it comes to people seeking treatment outside of the United States. It's impractical for the sick. People that are really, really sick obviously don't have the option of traveling halfway across the world to have treatments done that they can't afford here in the United States. And that kind of brings me to my own personal negative opinion on the globalization of healthcare, and that is that for people that are really sick or people that just need a checkup, I definitely don't think outsourcing and sending our own citizens outside of our own country to seek treatment is the answer. I think that people should be able to seek treatment here in their own country, be able to afford it. I think that healthcare is a basic human right for everyone. So there's definitely, I think, a little bit of a negative and a positive when it comes to that. So in regards to the future of the globalization of healthcare, I think that we're going to be seeing a lot more of it in the future. In 2006, medical tourism the industry had grossed about $60 billion worldwide. And then in 2012, that had risen to about $100 billion worldwide. So in 6 years, has almost doubled. So it's definitely increasing in terms of medical tourism. I think in the future, as I had mentioned, there's an opportunity for some savings by sending Medicare and Medicaid patients for certain treatments that are expensive here in the U.S., finding ways that we can pay for them to go and have these treatments done in different countries definitely could save our country a lot of money and hopefully get us back on track where we need to be to hopefully in the future provide healthcare services directly here in the United States and not have to send our own citizens to other countries in order to receive healthcare services because we can't pay for them to have it here. But it's definitely looks like it's something that's being considered for the future. And then finally, it really, I think, in the future, if the globalization of healthcare continues and medical tourism continues to increase, there's a lot more incentive for healthcare professionals that come from different parts of the world to stay in different parts of the world. A lot of healthcare professionals from different parts of the world end up coming to the United States because they can make more money out here. If all of us are traveling to different parts of the world in order to receive healthcare, they're more apt to stay in those areas where not only we are seeking the treatment, but also their own people. There's a kind of a problem with people in other parts of the world coming here and leaving their countries, and then there's nobody left in that country in order to provide healthcare services. And with globalization of healthcare increasing and kind of integrating throughout the world, hopefully a lot of those medical professionals will find incentive to stay in their own countries. And that way, ultimately that's going to be a healthier world. So relating some of the concepts that we learned in global communications to the globalization of healthcare, I kind of scanned through the book and went through the different chapters that we had gone over and kind of found different quotations and concepts and terms that we had learned and found ways that they related to the globalization of healthcare. So the first thing that I came across was the communication for development. In the text it says it's used to describe systematic use of social systems communication resources to stimulate, promote, and support human development. I think access to media and internet has definitely enabled the discovery of new ways for more people across the world to access healthcare. And the globalization of healthcare can mean healthier people in the world, living longer, free of disease and ailments. So the globalization of healthcare through communication will certainly continue to stimulate, promote, and support human development throughout the world. The second chapter that I kind of looked over that I thought had related to the globalization of healthcare was the chapter entitled State Development and Communication. The text states what is agreed upon in terms of defining the state is a political unit with rule-making power existing within geographic boundaries. Geographical boundaries are breaking down in terms of access to healthcare. If the state deems certain treatments not allowed for citizens in a particular boundary or outside of their price range, these boundaries, at least in our state, it's our right to cross these boundaries and seek these treatments outside of our own country that may have not necessarily been banned by our state, but just are, for whatever reason, unattainable for us. So the definition of state, in a sense, is challenged when looking at the globalization of healthcare. The third chapter that I had looked over and found some connection was the diasporas and contraflows beyond nation centrism. And I took a quote from the book that reads, "The debates on the direction of communication flows have long moved away from the original cultural imperialism thesis, which implies linearity and one-way relationships of causality between producer, West, and receiver, and the rest. More recent debates on multiple flows, asymmetrical interdependence, and transnational corporate networks have studied the global and regional complexity, shaking off the stigma of linearity and causality." So this was interesting to me because it lists the producer as the West and the receiver as the rest. And really the use of medical tourism among Americans kind of reverses this role, as Americans are now, receivers of what the rest is producing, and in this case is affordable health care. And then finally, in one of the last chapters, Counter Hegemonic Globalization, there's a quote that reads, "Transnational social movements in the contemporary political economy When people invoke globalization, they usually mean the prevailing system of transnational domination, which is more accurately called neoliberal globalization, corporate globalization, or perhaps neoliberal, corporate-dominated globalization. Sometimes they are referring to a more generic process, the shrinkage of space and increased permeability of borders that result from falling costs of transportation and revolutionary changes in technologies of communication. This shrinkage of space and increased permeability of borders has resulted in an ability to seek out products and services that in the past were simply not available due to your geographic location. So this really illustrates that although the term globalization still in some ways is very much tied to the exchanges of goods and services and is very much to do with the integration of corporations among other countries, it's now moving into another direction and dimension with an expansion and endless possibilities of what goods and services are being globalized. And in this case, it's medical treatments. So in conclusion, researching this topic was really enjoyable to me. It's something that I've wanted to look into for a while. I learned a lot about how globalization has affected healthcare and some of the ways that it really can improve healthcare in our nation and around the world. I was happy to be able to relate some of the concepts in the course to what I had researched. The concepts were a little bit hard for me and complex, and it was nice to kind of connect them with something that I took a personal interest in and kind of relate it to something in my own world. So I really appreciate your time. Thank you so much.